Hi, I'm Dr. Lindsay Allen.
I'm Dr. Carrie Roberts.
And I'm Dr. Erica Montes.
We wanted to introduce ourselves as part of Dr. Wilson's practice as the surgeons of the group. We offer minimally invasive gynecologic surgery, and we're very excited to just explain a little bit more about what that means. A little bit of background is just in general, minimally invasive surgery is a great technique that offers patients quicker recovery, but also just less surgical risks. And so I just wanted to take some time. And Carrie, do you have a little bit more about how we get patients ready for surgery?
Yeah, so we have pretty similar techniques, I think, when we see our patients. When we do a surgical consultation, we meet with the patient, ultrasound, lab work, if necessary, same day. And then usually we can get them scheduled right away and they can start planning their lives accordingly.
Yeah, and for me, I was trained using the robot for my laparoscopic techniques. So it offers a little bit more precision and visualization for myself. And so we are happy to offer either option, laparoscopic or robotic laparoscopy.
Yeah, and I think with the three of us, all of us have a ton of experience in the OR and using different techniques that we need to for endometriosis or fibroids or bleeding. And so it's nice to have the three of us available and our schedules too. Then patients can get in and get their surgeries done fairly quickly. Yeah.
Absolutely. We each have a day of the week dedicated every week to our surgical operating day. So it really just opens the availability for patients to get their needed procedures done very quickly. And it's important. I mean, we can actually offer a lot of solutions with these surgical techniques that are going to improve your quality of life, you know, from abnormal bleeding to pelvic pain to fertility. I mean, there's just such a wide range. And again, just the experience with the laparoscopic, minimally invasive techniques makes a huge difference for getting back to your normal life and routine right away. So
I think just to kind of like piggyback on that, since we do so many similar surgeries, if one of us isn't in the office because we're doing surgery and something comes in, then we're able to kind of cover for each other. And we do so many cases that kind of overlap. And so patients can feel comfortable being seen from a post-operative standpoint with any one of us.
Yeah, we feel comfortable with seeing each other's patients. I mean, we're kind of one in the same. And so, you know, post-operatively, we usually want to see patients back around the 2-week mark, just to make sure the incisions are nice and healed. Obviously, if you see any redness, any drainage, having any weird symptoms like a rash, please notify us because we would want to see you. And then a little bit of bleeding after surgery can be normal. But anything that's more than a pad an hour, we definitely would like for you to call us.
And we would want to see you same day.
For sure.
Yeah.
And we're available 24/7 and one of us will be on call. So that's really important to just call us and we'll be happy to triage you.
Right, exactly. That's really great points about some of the anticipated recovery, what's normal, what's not. And I think what's great about our office is that we really go over all of the details. I mean, when you come in and get scheduled for surgery, you're going to know exactly what's going to happen. You know, where do you go? Where do you check in? We'll have everything explained. And we have a lot of preoperative steps that are really crucial in making your surgical experience, you know, go nice and smoothly. We have preparation for skincare. We have preparation for our bowel and intestinal tracts, and all of these make a big difference with your recovery. So it's really great to have all these things worked out ahead of time. And, you know, patients give us feedback a lot of how smooth the process was. And, you know, it really just gives us confidence in saying, you know, confidently, this is what we can offer and what you'll expect. And really deviations from that are very minimal. So it's nice.
And I think it's also good that we will give you a folder with everything written out, instructions, any questions, expectations, because I know when we kind of throw a lot of different things at you, you might forget half the things we say. So please refer to your folder with all the information that you might need.
One thing to just kind of explain right off the bat is what is laparoscopic surgery. So generally and very basically what that means is we're able to work inside the inner abdominal cavity and access our pelvic structures like the uterus and the ovaries through tiny entry points on the abdominal wall. So we're able to use maybe 3 or 4 entry points to actually get inside that space. And this helps avoid a large incision. That is really what makes surgery more daunting and the recovery longer. So when we are able to use the tiny entry points, it really saves the patient a lot of downtime and ease with recovery, less pain. So laparoscopic surgery is crucial for offering patients getting back to your normal life just so quickly. And so there'll just be a couple more points, I think, about what that means for them experience-wise, during and after surgery too.
Yeah, and I think just the size of the scars. I mean, we're talking like 5 millimeters, just it's tiny, tiny. And so even cosmetically, after a procedure like this, how the belly looks, most of our patients are quite happy with how the scars look afterwards.
Yeah, I think even at the 2-week post-op, I mean, they're healing very well, and I think even by a year, the scars are almost non-visible, invisible. Yeah, and then after surgery as well, because of that gas or the CO2 gas that we use to visualize the pelvic structures, you can have some symptoms of bloating and also some referred pain to your shoulder, and that's very common, and it'll just dissipate over time. And then another symptom that patients complain about after surgery is we do have to put a Foley catheter in your bladder. So sometimes you can have a little bit of like burning and just kind of like symptoms of almost a UTI, but don't be nervous about that. It's usually just from the catheter being in place.
Yeah, the bladder and the uterus are so close to each other. So having a full bladder really limits our ability to see and to operate safely. So absolutely, the bladder needs to be drained.
Yeah.
And those points are crucial to know about what to expect afterwards. And the amazing thing is that, within literally 48 hours, maybe 72 hours, I mean, these symptoms are out of your life and you're really back on your feet 100%. Sure. So it's very minimal as far as, really feeling down and really like, surgery was this horrific thing. Really, it's not like that. Laparoscopic techniques and these little points that we want you to know about are really where we can give you a great surgical experience with, just quick recovery, safe procedures, lower risks of complications.
For sure. Yeah. And I do think that our patients feel confident in what was done and what is going to be done, because I can't tell you how many times I'll have a patient be like, I don't know if I have ovaries. I never really asked, or no one ever really told me. I feel like that's a really big determination. And so we have everything written out, everything in your folder, everything is extremely well explained. So people really know what is going to happen and what did happen.
Yeah, so, I love that.
And after surgery, we all will go over at the post-operative visit, pathology, results of the surgery, operative photos. We really want you to understand what things were done, what things look like, what this means for future, if anything. And it's crucial. I mean, education, and this is why we're doing these talks too, because we want you to know and feel confident and comfortable. Education is key in any kind of medical procedure, especially surgery.
Well, ladies, that was really, really informative. I feel like we really recapped what we perform and how we offer surgery for our patients.
Yeah, thank you. Thank you, ladies.
Yeah, thank you. It was great to get a chance to sit down together, and we're excited to look forward to taking care of you.